Good evening and thank you for joining this short symposium in which we seek to introduce a new male continence management solution in the context of retracted penis and in doing so reduce CAUTI. iMEDicare Limited is a specialist medical device distributorship since 2004, focusing on the introduction and supply of innovative and market-leading medical device solutions for male and female incontinence. So let's take a look at some of the causes of adult acquired retracted or buried penis. Number one, most commonly class 3 obesity. Excess fat around the abdomen and genital area can make the penis appear to be hidden. Lymphedema, in which swelling around the scrotum area due to the collection of lymphatic fluid may cause the penis to become buried inside the surrounding tissue. Or, of course, chronic erectile dysfunction, which is severe disuse atrophy, especially in the context of reducing testosterone in elderly male patients. So men with buried penis may be unable to urinate while standing or even sitting without getting drops of urine on the skin of the scrotum or thighs or clothes. Infections in the urinary tract and genital area are common due to constantly moist skin, and in the uncircumcised men, the skin covering the head of the penis may become inflamed. Men may be unable to get an erection, and even if they do get an erection, it may be painful or may not be able to penetrate. Retracted penis may also impact on male self-esteem and can lead to depression. Managing urinary incontinence can also be particularly challenging in the context of retracted penis, especially if the penis shaft is too short for a conventional condom catheter. Disposable incontinence pads may also not be suitable for medical reasons. This can lead to the introduction of a FOLEY catheter, which the American Nurses Association indicate leads to an increased risk of UTI from 3 to 7% for each day that the catheter is in place. The annual cost of CAUTI and CAUTI complications to the NHS are significant, with up to £2,000 additional cost per CAUTI patient. Urinary tract infections are the most common healthcare acquired infection, accounting for 17.2% of all HCAIs, and between 43 and 56% of UTIs are associated with an indwelling urethral catheter. Consequently, CAUTI reduction is a key healthcare economic policy for the NHS. So this leads us to the introduction of Bioderm petal sheath urinary catheter, also known as Men's Liberty, when it's fitted with a 240ml thigh bag. Both options are available on community prescription in a 4-pack starter kit or a 10-pack ongoing maintenance kit. Pharmacies and DACs can order from iMEDicare directly or from the specials division of their preferred wholesaler. The Men's Liberty petal sheath is adhered directly to the skin of the penile glands, having retracted the foreskin. Men's Liberty is made from hydrocolloid, a proprietary adhesive that creates a secure, skin-friendly seal around the urinary opening. Hydrocolloid has been used successfully in wound and ostomy treatment for decades and is not made with natural latex. Men's Liberty has a completely external design and will fit most male anatomies, a one-size-fits-most concept, and will keep men dry and comfortable for an average time of 24 hours, but can be used for up to 48 hours, obviously replacing the need for disposable diapers or condom catheters or medically unnecessary FOLEY catheters. The drain plug conveniently serves as a universal connector to which you can attach an additional thigh bag or an extension tube with a bed bag. A 16-month study at a 107-bed acute care facility in the United States using Men's Liberty over an average 24-hour wear time led to a reduction in the use of FOLEY catheters by 19%. Also led to no complications or adverse events or CAUTI occurrences for the male patients involved. Men's liberty will benefit men with small or retracted penile anatomy. Uncircumcised patients should have a retractable foreskin. Also scenarios in which a condom catheter has failed either because of an injury or an infection or simply failed to adhere, or in a case where there is neuropathic skin or reduced skin sensation. The Men's Liberty petal sheath is hypoallergenic and very easy to apply to the penile glands, creating a completely occlusive seal that directs urine away from the penis directly into the leg or bed bag. The gentle hydrocolloid material is soft and stretchy and confirms comfortably to the penile anatomy. As with all condom catheters, correct and careful skin preparation is critical to glands adherence. The skin of the penis glands should ideally be washed with a non-moisturizing soap or detergent and dried thoroughly before application of the alcohol wipe. To prevent urine escape during the adhesion of Men's Liberty, a Bioderm kind clamp can be applied to the penile shaft if it is sufficiently long to do so. When the BioPlus adhesive agent is completely dry and no longer tacky to the touch, Men's Liberty petal sheath should be applied such that the vent is positioned dorsally. Correct application of the faceplate seal will help to ensure adequate adherence of Men's Liberty catheter for up to 24 hours before fixing either a leg bag or a bedside bag. Freederm adhesive remover instantly removes hydrocolloids and other adhesives. It flash dries in less than 15 seconds, allowing immediate reapplication of an adhesive device without washing. It reduces skin trauma from tape and dressing removal, including infection risk, inflammatory damage, and edema. Oil and moisturizer free, as well as being free of any harsh chemicals. Men's Liberty was independently evaluated by a large Midwestern hospital chain in the United States. The findings for the male patients indicated that 72.8% of men were likely to advocate the use of Men's Liberty to other patients. The evaluation results also indicated that the male patients involved preferred Men's Liberty on every attribute assessed. In summary, it should be clear that the uniquely designed and patented Men's Liberty petal sheath can become a very useful addition to your armory for managing both incontinence in the retracted penis and as part of a comprehensive CAUTI reduction strategy. If you would like more information or demonstration samples, please do not hesitate to reach out to us on mypelvichealth.co.uk or email us on contact@iMEDicare.co.uk or simply call 01923 23 7795. We'd be delighted to hear from you. So let's turn our attention to UriCap Female, which is a brand new sustainable platform for urine collection for semi and non-ambulatory females. It improves the quality and reduces the cost of healthcare for a very large percentage of incontinent ladies. Adult diapers can come with serious drawbacks, which include multiple changes per day, leaving a patient potentially wet and uncomfortable with odor issues, sometimes recurrent infections, bed sores, let alone the consideration of the massive amount of waste material going into landfill. Climate change is real, and any product or initiative that helps us reduce our environmental impact is something we need to consider. Indwelling Foley catheters can be uncomfortable and painful to administer and require generally a qualified nurse or doctor to apply in the first place at considerable staff cost. Also potentially leading to the risk of CAUTI infection. 40% of all hospital-acquired infections are CAUTI associated and can lead to serious morbidity and indeed mortality. UriCap Female is a highly innovative solution addressing the need for safe urine collection. It forms a natural seal surrounding the urethral opening whilst protecting against fecal contamination. There's no suction, there's no glue, no tape required. It's made of medical grade silicone. Each UriCap can last for up to 24 hours of use. UriCap can also be used as an ideal solution for obtaining a clean catch urine specimen. UriCap is a very compact external catheter for ladies whose lower lip reaches just inside the vaginal orifice and whose upper lip extends just beyond the urethral meatus, both held in place against the skin with a natural surface adhesion principle. Labial folds sitting over the top of UriCap provide additional security. Each time the patient voids, the security of the securement is improved. There are many advantages in using UriCap in a hospital environment. The main one, we believe, is CAUTI reduction by avoiding the need for FOLEY catheter usage. This reduces the morbidity and mortality rates to your patients whilst providing them with a comfortable solution for an undisturbed night of sleep and better skin control with reduced risk of incontinence associated dermatitis. UriCap also removes the obstacle of taking a clean catch urine specimen culture from a bed-bound incontinent woman. As we said earlier, climate change is real, and UriCap affords the opportunity to produce small volumes of waste material with low environmental impact, avoiding the concerns associated with significant pad usage, transportation, storage, landfill, incineration, urine leakage are all serious concerns that need addressing urgently. The physical waste benefit in switching to UriCap can be very difficult to visualize, so let's take an example from the United States. Let's imagine 3% of the US incontinent female population switched to UriCap. That would produce the equivalent of a tenement building with 5 stories of waste per annum. This would displace the need for 38 similarly sized tenement buildings made with disposable diapers. Absorbing UriCap into your daily care protocols will obviously require considerable educational input from iMEDicare and UriCap. We provide significant resources by print, user guides, reference guides, educational samples, user evaluation tools, and online training videos with demo kits. We can, of course, also provide sample kits for trial patient usage. We can also provide access to a very comprehensive online learning management system for UriCap that details indications, contraindications, warnings, a detailed instructional for use training module coupled to diagrams, interactive AI bot discussions, annotated videos, annotated diagrams, and a testing system to ensure progress is based on knowledge. The iMEDicare patient care ethos places the patient absolutely at the center of all caregiver interactions, and that their patient dignity and comfort is paramount above all else. We're obviously aware that the cost of incontinence products can be a big strain in the budget of any healthcare provider. Therefore, we offer smarter, potentially safer solutions that can, in the longer term, reduce costs. Currently, we have 12 full-time Tier 3 MIA accredited representatives with a comprehensive medical knowledge and specialization in pelvic health, including incontinence management, able to support your hospital fitting service, patient education, staff training, and ongoing patient support both in the acute setting and upon discharge. We appreciate your time is incredibly precious, and we'd like to thank you very sincerely for your attention in this iMEDicare Pelvic Health Naturally presentation, and hopefully you'll have a chance to look at our website, mypelvichealth.co.uk, for further information on all products and services. Thank you.